Let me invite Dr. Mallika Harikrishnan, Professor, Government Medical College, Thrissur, to speak to us on an introduction to non-strabismic binocular vision anomalies. Over to you, madam.
Good morning, one and all. Thank you, Dr. Samyukta, for giving me this wonderful opportunity. My topic today is an introduction to non-strabismic binocular vision abnormalities. In the previous era, when man's survival depended upon hunting, fishing and farming, his visual system depended upon very clear distant vision and stereosis. But in the modern era, when there is changing of his, he is more adapted towards the near vision and this binocular vision, like because he is more dependent upon reading, desk work and computer work. So what happens is that in some people the visual system is not able to do this function properly either because the tasks lack the stereoscopic cues or the tasks require accurate and sustained accommodation and vergence functioning. So due to this, some people, due to lack of appropriate vergence or accommodative ability, if they try to do near vision tasks, that will result in ocular discomfort or fatigue. So what is binocular vision anomalies? Binocular vision anomalies are vision disorders that affect an individual's ability to maintain focus on a single object with both eyes. They also include disorders that prevent the brain from fusing the images from the two eyes into a single vision. So what is actually vision? It is not just reading 6 by 6. It is a process of deriving meaning from what is seen. And it includes a number of processes that happen in a hierarchical manner at the neuronal level. These are, first one is the fixation. You have to fix at an object. Second one is the monocular accommodation to see an object clearly. And the third one to integrate the processes in both eyes to have a single clear vision, that is vergence. And the fourth one is the oculomotor function, which helps us to track an object we are fixing. This is a representation of conceptualization of vision. This is represented as a pyramid. The base of the pyramid is constituted by comprehensive assessment of eye and visual system, where you assess the eye as such, anterior segment, posterior segment examination, you do the refraction and all. And the second thing is the visual efficiency or binocularity. Third one is the oculomotor testing. And fourth one is the perceptual assessment or visual information processing. What is important is that you should concentrate on the base of the pyramid. Unless you do proper assessment of the appropriate refraction testing and correction, unless you do the proper correction, you are not doing any justice to the rest of the pyramid. So the question comes, is there any need of binocular vision care? Yes. Because we are not dealing with any Cyclops or Mr. Cyclops or Octopus. We are dealing with a man with two eyes, and the two processes happening in the both eyes has to be integrated to get a single vision. I would like to share a few recent papers. This is a paper showing the prevalence of non-strabismic anomalies of binocular vision conducted by Rizwana et al. And it shows that the prevalence of NSBVA among children in the age group of 7 to 17 years is nearly 30 to 30.8%, where the convergence insufficiency is 16% and accommodative infacility about 11%. If you check the global data, it is almost similar or even more than this. Gives you the inference that it is not occurring, it is not confined to one part of the world. So what about the adults? Here also thing is not different. About 56% of asthenopic symptoms can be attributed to binocular vision abnormalities. This is another paper where they decided to what is the ocular and visual discomfort associated with smartphones, tablet and computers. And they found that this increase there is increased lag of and decreased amplitude of accommodation with handheld devices, and the smartphones and tablets reduce the functional convergence. So if you look at the digital eye strain also, 90% of the digital device users also experience digital eye strain attributed to uncorrected refractive error or accommodative and convergence anomalies. So who are the people we are targeting at? It may be school children, an IT personnel, a sport personnel, an accountant, or even it may be you and me. Everybody is in neuropathy, myasthenia gravis, etc. And for the cause, as causes of accommodative dysfunction, you can have a few drugs which can cause bilateral NSBB abnormalities, unilateral local eye diseases, and general diseases in adults like encephalitis, syphilis, trigeminal neuralgia, myasthenia gravis, etc. What is important is that if some people will present with acute onset of NSBBA abnormalities, you have to remember all these conditions. This is a drug list which can cause accommodative dysfunction. You can keep it in your clinic. And this is the suggested questionnaire to elicit the NSBBA abnormality. So what is important is that binocular vision abnormalities are common in our daily practice. The testing to be included in the primary eye care system, and you have to ask the right case questions, and you have to evaluate the patients using right tests and make the diagnosis. Thank you so much.
Thank you, Madam.